Hello, I'm Donna Williams, and I'm going to talk a bit about dissociative identity disorder and the road to diagnosis. I have had several labels and diagnoses throughout my life. The first one was psychotic when I was 2 years old in 1965. That was a hospital assessment, and I was deemed psychotic because I appeared deaf, had no pain response, and had self-injurious behaviours. And then next label, I was disturbed because in school I was echolalic. All my communication was self-directed, a lot of singing, a lot of self-chatter. People couldn't understand a lot of what I was saying, or it was a lot of stored phrases, jingles, big chunks from the TV, very much kind of in my own world. And my behaviour was uncontrollable, so I was always out of a seat, very distracted. I swung between very quiet and withdrawn and phobic, and being someone who was very cut off, very self-protective, spending a lot of time on my own, often behaving like I never met the kids in my life, these other kids, I didn't know them. And then other times being extremely manic, very giggly, grimacing, jumping on people, squealy, running away, climbing up to heights, all that sort of stuff. So that was deemed, disturbed. And then as I got older, by the time I was 10, I started being very violent. So pushing kids downstairs, throwing chairs, shoving tables. I'd always had the self-injury issue, and by that I mean face smacking, punching, hair pulling, and so that was still deemed part of being a disturbed child. When I was 9, I was still being tested for deafness because I appeared to not understand speech, and then they basically said she's meaning deaf, she can't understand speech, or speech was slowed down, bullet points, representational objects, gestural signing, and they came to do the one word, one meaning system, and it was assumed that, okay, well, she'll kind of get over it now, and that didn't happen. There was at times episodes of agoraphobia, fear of coming out of the room. There was sort of self-starvation stuff, and there was forced vomiting stuff, and there was peeing in my room stuff, and there was ripping on my clothes stuff, and there was dropping objects all the time, and spinning everything, and going round and round in circuits, and having to repeat patterns over and over. So OCD kind of broke out, and I'd always had tics since I was about 2 years old, and had mood fits since I was at least 3. I had about 6 of these mood fits a day. So it was generally deemed, well, that's still part of Donna being psychotic. It's part of Donna being disturbed. I went to high school. I was still treated as the disturbed child. Several high schools, I think 4 high schools in my first 3 years. Then I was basically dealing with homelessness and sexploitation, and one of the results of that was at 16 I came to see a shrink because of attempted suicide, and the shrink generally saw, again, very different Donnas, extremely withdrawn Donna, extremely manic Donna, extremely sort of schizoid, self-protective Donna, very risk-taking Donna, and she basically saw me as disadvantaged and needing social work and needing to get off the street and get an education and get away from the sort of problem people, and then I'd somehow kind of graduate. And so Willie went to college and Willie university, and as far as the psychiatrist was concerned, Donna had somehow graduated, and so that now the problem was taking care of itself. And at university, I was still mostly fluctuating between Carol and Willie, so very self-protective, logical, practical, determined, conscientious, if you like, schizoid self, and then a quite sociable pleaser, mirroring everything to try to fit in, anything, everything, just try and fit in, just try and pass. And if they smile, then smile. If they laugh, then laugh. And at home there would be little Donna, who would still have all her objects and live in the world of textures and rub leaves and put her face into the fur of the cat and move things in my ears and sort of enjoy the sounds. And so there was the sensory Donna, but there was no place for that retard in the life of the one that had graduated to university. And certainly in my last year at university, I dealt with a particular staff member who was very provocative, using quite sexually suggestive language in his office, and he would put his face up very close and put his body over me as he would use this kind of language. So as a result of this, I was very manic and very flighty because I dealt with similar related behaviours in my past. And so I guess people just tended to think, well, that's her, she's this. No, that's her, she's that, whatever. And after I wrote the book Nobody Nowhere, its original subtitle was Autobiography of a Disturbed Child, but because I came to be tested and formally diagnosed with autism, the educational psychologist that I was seeing was much more interested in cognition and interested in sensory perceptual issues, which were extremely relevant. There were major issues happening there that really needed to be picked up and that I was very ashamed of, and parts of me were busy hiding all the time. And here was a chance to not be ashamed of it and actually deal with it. So when the issue about other selves came up, it was very secondary in a sense for this educational psychologist, so that wasn't dealt with. And then because my book became so important in the autism world, and the publishers changed the subtitle to Autobiography of an Autistic Child because I was diagnosed with autism. And then nobody really wanted to hear about other selves. They only wanted to hear about the cognitive side or sensory perceptual stuff, or they didn't want to talk about identity or being emotionally disturbed or anything. In fact, I was told that because I'm autistic, I'm not emotionally disturbed. I'm like, maybe I'm both. And anyway, so I then saw a hypnotherapist for 4 years for post-traumatic stress disorder. And she was really wonderful, and she did a lot of really good work. Her work is what's called dream work, hypnotherapy. So you're basically still awake, but she's guiding you through kind of dream imagery. And I mentioned again my other selves, and she didn't really want to go there because she didn't want to reinforce them. So years later, in a sort of standard medication update appointment with a psychiatrist who's a complete stranger, I was in there for 45 minutes, and he said, you're schizoid, and what's more, you have dissociative identity disorder. He said, do you have other selves? And I said, yes. And we started talking about my history of abuse and stuff like that. And I've been taking all the DID stuff up with my already existing counsellor, which is going well, but that's why it took me until I was 46 to really get a formal diagnosis of DID.